Well, March is Women's History Month, and today we're focusing on women's health and looking at menopause.
And joining us with more is our 9 Health expert, Dr. Payal Kohli. So let's just start with some of the simple stuff. The average age of menopause, when should a woman start thinking about it, becoming aware of it, maybe see it coming?
So menopause is something that's going to happen to every single woman, right? And it's usually between the ages of 45 and 55, with the average age here in the United States around 51. But I have to say it's highly variable, and it's very much dependent on your personal history, your family history, as well as when you started your period. So women can actually start becoming menopausal in their early 40s, and I have several patients who are in their late 50s who
so
still
if you get your period as a very young woman, would you then go into menopause younger as well?
Possibly, or it could be that your kind of reproductive life cycle is a little bit longer.
Okay.
And so what we're seeing overall as a trend here in the United States is that the average age of menarche when women start having their periods is actually getting earlier and earlier because of childhood obesity, because of what we're eating, those types of things. But that can also affect when we hit menopause because our reproductive life cycle, how many eggs or ovaries release, is really sort of fixed.
So I am curious, because we were just talking about that. I know a lot of women are like, I don't know, is it menopause, is it not menopause? What symptoms are you looking for that maybe you need to start a conversation with your doctor?
Yeah. So I would say the earliest symptom is probably those irregular periods. They're either having them too close or too far apart, they're coming too heavy or too light, and you need to make sure you're not pregnant, because you can certainly obviously get pregnant in your 40s as well. You can even have premature menopause. So in your 30s, if this is happening, it's time to have a conversation. There are other symptoms, mood swings, hot flashes, trouble with sleep, gaining weight. These are all symptoms of menopause. But in the end, what doctors will often do is do blood tests. And it's not just a single blood test, but that particular blood test kind of done several months apart that will tell us whether in your brain you've started hitting menopause, because your brain will change your blood levels, this biomarker called FSH or LH, based on how much estrogen it's seeing.
As the dumb guy in the room, but some of these questions like what does it mean? Why is it important to know that you are in fact in menopause?
This is the most important question, Tom, and the reason is because this is a huge inflection point in a woman's life, in her health, in her physical and her mental health. Obviously, after menopause, you can't carry a pregnancy anymore, so your reproductive life cycle is over, but it has a dramatic impact on cardiovascular disease because estrogen, which is released from the ovaries, protects our blood vessels, protects our heart. So after menopause, a woman's risk of heart disease really, really goes super high. Her bone health gets affected. Her risk for cancers gets affected, and many women start to have mental health issues, start to have problems with sleep, and you can gain a lot of weight because your metabolism is dramatically different.
Critical to know.
Absolutely. Yeah. I know a lot of people talk about hormone therapies. What is out there, and what do people need to know about the pros and the cons of it?
So hormone replacement therapy is so trendy, and I'm talking not just estrogen, but even testosterone in women, because we know that ovaries make testosterone as well. And when you hit menopause and the ovaries turn off, that testosterone level can go down too. And so I would caution women to go on extended hormone replacement therapy because it really has been associated with a lot of risks, cancer, heart disease, and others. But short-term hormone replacement therapy may make sense. So if you're thinking about hormone replacement therapy to treat your symptoms of hot flashes or maybe for bone health, it's about individualizing, having a conversation with your doctor, not just about whether to take it, but how to take it. Do you take a pill? Do you take a patch? All of those have different risks. And then importantly, to make sure your body doesn't see estrogen for longer than it's supposed to. So if the average age of menopause is 51, most 51 or older women shouldn't be on hormone replacement therapy for extended periods.
So this sounds like a conversation that a woman should be having with a doctor at 45 at the latest. Yeah. And then you have to figure out what you want to do about it at that point.
On an ongoing basis.
Yeah.
And before, during, and after menopause, like I said, the biggest transition in our lives, the biggest inflection point in our health, we need to raise these questions, but we're only going to be able to raise them if we're looking for the signs and symptoms, because many of us have trouble with our sleep, our mood, our, like weight gain, those types of things, but this could be a sign that menopause is coming.
Well, such an important conversation. We appreciate you stopping by. Of course, you can find more with Dr. Kohli at 9news.com/Dr. Kohli.